You've probably been there. You see a small, red, painful bump on your skin, and your first thought is, ugh, a spider got me. We all do it, but what if I told you that most of the time, it's not a spider at all? Today, we're going to play detective and solve the mystery of the spider bite that isn't.
And hey, don't just take my word for it. This is a direct quote from a clinical care guide. It's telling doctors flat out when a patient says spider bite, you should be thinking staph infection. Right there, that one sentence completely flips the script and puts us on the trail of a different culprit.
So, if it's not a spider, what in the world is causing these things? Well, the confusion is understandable. The way your body reacts when bacteria invade, the redness, the swelling, the pain, it looks a whole lot like a reaction to some kind of venom. But the real answer is usually something less exotic and potentially way more serious. Okay, let's pull back the curtain. We're about to enter the world of SSTIs. That stands for skin and soft tissue infections. This right here is the real culprit behind the vast majority of those so-called spider bites. So let's dive in and figure out what that actually means. An SSTI is, at its core, pretty simple. It's just an infection in your skin and the fatty tissue right underneath it. Now, the two main players you'll see are cellulitis, which is that spreading, angry red inflammation, and abscesses, which are those classic, painful pockets of pus.
Now, what's really fascinating is how these infections even get a foothold. They need a way in, a portal of entry. Think of your skin as a fortress wall. Any little break in that wall, a tiny cut, a scrape, or bigger things like injection sites or an unsanitary tattoo, can be an open door for bacteria to sneak in and start causing trouble.
And just so you know where all this great information is coming from, this entire explainer is based on a really detailed clinical guide from California Correctional Healthcare Services. These are folks who deal with these kinds of infections all the time, so their insights are absolutely top-notch.
All right, so imagine a patient comes in with a painful red spot. The investigation begins. Just like a detective showing up at a crime scene, a clinician has to start gathering specific clues to figure out what's going on. Let's take a look at their checklist.
This is the absolute core of the investigation. Every single question is a piece of the puzzle. The timeline, what the sore has been doing, and especially those precipitating factors like a recent cut or drug use. It is all about piecing together the story to find the root cause.
So after gathering all those initial clues, our clinical detective comes to a critical fork in the road. This single decision point they're about to make is going to determine the entire path of the investigation and, more importantly, the treatment.
And it all comes down to this one simple question. Is it purulent or non-purulent? Basically, is there pus or not? It seems simple, but the implications are huge. Purulent means there's pus. Think of a classic boil or an abscess. Non-purulent means there isn't. It's that angry, spreading redness of something like cellulitis. I can't stress this enough. Pus or no pus. This one distinction is everything. It is the key that unlocks the entire treatment plan. If you get this step wrong, the whole approach could be useless. Okay, so we've identified the type of infection. Now we have to figure out the threat level. How dangerous is this, really? Because not all infections are created equal, and some can turn life-threatening fast. To gauge the danger, clinicians use a scoring system called News2. It takes a patient's vital signs, like temperature, heart rate, blood pressure, and crunches them into a single risk score. Just think of it like a danger meter. Green is mild, yellow means pay close attention, and red means you've got a potential emergency on your hands. And speaking of emergencies, these are the drop everything red flags. We're talking about things like huge blisters, skin actually peeling off, or redness that's spreading like wildfire. These aren't just symptoms anymore. They are screaming alarm bells that signal a deep, destructive, and potentially deadly infection is underway. So, we've identified the type of infection, and we know how severe it is. Now it's finally time to take action. It's time to build the treatment plan.
Hey, remember that fork in the road? Pus or no pus? Well, here's where that pays off big time. For those purulent infections, the ones with pus, the first move often isn't antibiotics. It's a procedure called incision and drainage, or I&D. The goal is super simple. You got to get the pus out. With an abscess, controlling the source is everything.
But of course, there's always an elephant in the room when we talk about skin infections today, MRSA. That's that nasty superbug that's resistant to a lot of our go-to antibiotics. Getting this wrong can have really serious consequences. So, when does a clinician really need to start worrying about it?
Well, a doctor's MRSA radar starts going off when they see specific risk factors. As you can see here, things like a recent hospital stay, injection drug use, or, and this is really relevant to our source guide, incarceration, these are all major clues. These aren't just suggestions. They demand a totally different playbook for picking the right antibiotics to actually win the fight.
And this brings us to our final clue, which might just be the most important insight of this whole investigation. The guide makes this incredibly powerful point that goes way beyond just the skin. It reminds clinicians that you can't just treat an infection, you have to treat the entire person. So many of these cases are tangled up with complex issues like substance use disorder, and that means the best medical care doesn't just stop when the abscess is drained. It extends a hand, offering a path to recovery. It's a profound reminder that good medicine never just looks at the wound, it always sees the person attached to it.